Hello and welcome to Chief Among Friends. I'm your host, Dr. Chris Hobson, Chief Medical Officer of Orion Health. On this podcast, I chat about topics ranging from technology priorities to new innovations in integrated and coordinated care to healthcare sustainability. You can follow the conversation on hashtag Chief Among Friends and be sure to follow me on Twitter at Dr. Chris Hobson. Today, I'd like to talk about advances in health information exchange and the strategic direction of their evolution. I'm interested in statewide HIEs, how they are progressing with the COVID-19 situation with respect to minorities and justice and equity in the health system, the 21st Century Cures Act, and the new CMS and ONC rules. Today, I'm very excited to have my friend Shila Blend with me to discuss all of this. Shila is a board-certified registered nurse, earned a Bachelor of Science in Nursing from MedCenter One College of Nursing, a Master of Science in Nursing from University of Mary, and a PhD candidate with focus on health systems at the University of Colorado Anschutz Medical Campus in Aurora. Shila currently works as the North Dakota Health Information Technology Director and formerly worked with the North Dakota Department of Health. She brings more than a decade of experience leading people and projects in the health system space, including patient care and implementation of software and statewide programs. Her leadership experience includes significant stakeholder engagement with state, local, and tribal partners, as well as healthcare associations, emergency management, and legislative members. Shila is a systems thinker who is passionate about improving healthcare systems. So, Shila, it's very great to have you here this morning.
Thank you, Chris. I'm very happy to be here. Thank you for bringing me on your show.
Thank you so much. So let's start with a bit of background on North Dakota Health Information Network. Perhaps if you could tell us what is unique and why it's successful, and perhaps something about your relationship with the state government.
Certainly. So a little bit of background on the North Dakota Health Information Network. We also call it NDHIN. This is a statewide HIE, and it's a public-private partnership, which was legislatively created in 2009. The infrastructure of this, it sits in our state government. My role is in our information technology department, but we work with partners across the government and also our private partners across the state. And actually, I am overseen by a governor-appointed board, which includes members from both public and private entities, which help advise and guide the direction of NDHIN as we've expanded and grown through the years. And go ahead.
Yeah, so having that board is one of the unique things that's helping you with guidance.
Yes. That board, I can take different things, and it really helps determine the direction and the priorities for the HIE, because it's not only coming from, what is at most advantage for the government, but really talking to, we have providers from the hospital association, medical associations, different hospitals, both critical access, which are smaller hospitals with 25 beds or less, and our larger tertiary hospitals in the state, really providing us guidance along with those other state partners as to what would most benefit the healthcare community across the state as we develop and work towards interoperability.
That's excellent. So I understand that you've been working recently in the last few years on the expansion project for the NDHIN. Perhaps could you tell us what are the key activities and benefits you expect from the expansion initiative? Yeah.
Yep. So NDHIN, we've been working closely with Orion Health over the last few years, who is the provider of our platform. And June of 2019, actually, I'll back up a little bit. An environmental scan in 2016 resulted in a 5-year plan on how to expand NDHIN's footprint across our state. And we had a few different key goals with that. And one of those was to expand our active outreach program to get additional providers and different types of data being contributed, and also to upgrade the HIE platform, which we upgraded our platform in June 2019 to Orion Health's Amadeus platform. And this provided a lot of advantages to NDHIN that we've seen, including enhancing those medication management tools. We're working with different data analytics and care coordination tools, and really working to improve that interoperability across the state. I know there were a lot of additional features, updated looks to the PDMP and our medication management, and we're really continue to add things. One of the most recent that providers have been very excited about is the addition of encounter alerts and notifications, where they can somewhat subscribe to a patient, which a rural state in North Dakota, that's beneficial because many of the providers that normally see patients are in critical access hospitals or more rural communities. And often if a patient has a severe illness, they're eventually transferred to one of the 6 larger tertiary care facilities. And this can be a way for providers to be kept up to date when their patients admitted or discharged from a hospital or have those critical lab values.
So it sounds like a continuous process of adding both functionality and new forms of data. One of our clients had a program, they called it Quarterly Pearls, and the idea was every 3 months you go into the HIE, there's something new. Sounds that you're kind of doing something along the same lines by continually adding things to add value.
We do, and we report out to our participants. We actually have a monthly newsletter that goes out that we're constantly promoting the new and exciting things that are going on with NDHIN and the functionality we're adding on and the types of providers, because as I've said, we continue to build because we want to have the best product to improve that communication and collaboration among facilities. One other piece I didn't mention about this update was the upgrade to Exchange Gateway. And that really helped us support us join on to the national network. And as we speak right now, we're working with onboarding to the Veterans Administration, and that also includes eventually onboarding to the Social Security Administration and Department of Defense, those different information hubs. So it's been very beneficial, and we continue to grow and expand.
And so, of course, that's definitely a kind of recommended approach to the HIEs generally, is to continue to grow and expand. But of course, in 2020, we've been hit with the COVID-19. So I was just wondering perhaps if you could tell us a little bit, maybe from the state perspective as a whole, and then where the HIE fits in, if it does, in terms of your responses to COVID-19?
Absolutely. So when COVID-19 hit the country and the state, North Dakota really, their state government has really a work as one approach that our governor promotes. And so with IT in general, our department stood up and said, what ways can we help? And, from what I've seen from the outside, there has been a lot of work to modernize processes. And it goes between processes and taking things that were originally paper forms. For example, when somebody would sign up for a testing site, there would be like a 2 or 3 page paper form that individuals would be filling out to be tested, and then going through a lab process. And that's a lot of paper, especially with the testing numbers that are occurring today. So very quickly, our state worked with our Department of Health and Lab and the National Guard, and we modernized a lot of those processes to be paperless. And so that was a beneficial tool to really help streamline that testing, because it allowed them to test more people and make the process go faster versus when it was in the paper days. Another area that we're seeing a lot of growth with during COVID is, using data to help determine strategy and track progress as we battle COVID. So across the country, you've seen a lot of dashboards pop up and different modeling techniques, and looking at the data to see, one of the big things we've heard is the curve and where we're at and where's our rolling average at. So states determining policy whether to open up travel or not, or do orders to wear masks or not. A lot of different decisions are based off of that data. So I think that is another area where IT has been very important, is, to help with the collection of data and also using that data to make something meaningful that can help with some of those determinations as we battle the pandemic in the country. Go ahead.
Yeah, well, one of the interesting ones from an interoperability perspective is probably the integration between the public health sector, public health data, and either the HIE or the clinical systems. How is that? Is that playing out in North Dakota? Or?
Yes. NDHIN, prior to COVID, we worked closely with our Department of Health with the syndromic surveillance and the items that were mandated reporting. Mm-hmm. So with the COVID, which has begun, and the testing capabilities increasing and more positive patients being identified, the case management and contact tracings efforts also increase. And so one of the areas we were able to utilize with our contact tracers was the notifications that if an individual was somebody they were monitoring that had tested positive, they could be alerted to know when that patient is admitted or discharged from the hospital. Prior to that, we had an actual individual who was calling individuals to check in, twice a day. And between that and other technology advancements to where a patient could, kind of self-report, we were able to cut down on those phone calls and the man hours involved in that. So that was one helpful thing that we were able to do. We were also able to work with our state health department to build interfaces so that they're able to do a few things, such as, provide their data that they're required to provide in reporting to the federal government. So we're able to assist with that. We're also able to assist with different facilities having interfaces with us, so they're able to do electronic lab ordering and reporting. And so this was a way that if that facility was doing testing, that they could electronically order from our state lab and also receive the results. So that was a beneficial area for them. And, really those interfaces have, really proved beneficial.
That's great to hear. I think obviously the issues with the scale of the challenge and scaling up quickly has been a challenge, and IT is able to step up in a lot of ways, which is really appreciated. Yeah.
And I think the biggest thing at HIE, before I forget, is, the ability with the connections with the lab to have that result in the patient's record as throughout the HIE, so that individuals in the future, if they want to look, they can look under lab values and see if this patient has tested positive or been tested for COVID in the past.
Right. So have you opened up or was it already available for public health people to view the HIE data?
We've been in partnership with certain individuals of public health. Ours, each individual has to sign an agreement with us to be brought on. So we've had the Department of Health on there, but like I said, it was the individuals accessing the data for the syndromic surveillance efforts.
Gotcha. Okay. So let's talk about the PCDH, the Patient-Centered Data Home. So I'm thinking about this from the perspective as an HIE in North Dakota connecting to the PCDH, and perhaps if the benefits to providers or other members of the HIE.
Yes. So a few months ago, North Dakota went live on the PCDH. We are part of the Western Region PCDH, even though all of the patient-centered data homes in the United States are interconnected, kind of woven like a quilt. So we went live on it. The biggest benefits for our HIE are making that network to be able to share patient information when it is needed, when the patient travels outside of the state. I think that's the biggest information. And then also having the ability to have a record of those other participating states if they receive care that's available for when they come back to their home state. So the example I use with this is in North Dakota, we have some of our residents may travel to, for instance, Arizona for the winter months. If an individual is seeking care down there, they do a zip code query. And if they're able to see that this individual is a part of the NDHIN and request very basic information on the patient's received care, so like an ADT, and which has the admission, discharge, transfer data, the basic information on, major health conditions, if they have any allergies or prescriptions. So they're able to get that information, provide that patient care, and streamline that communication. And when the patient care episode is done, they send us a summary to put in our record for the patient. And it just really helps that collaboration and streamline communication to really benefit the patient as well.
That's great. It's really very good to see. Just a sub question, are you seeing good adoption? Do you know how often it's actually being used?
Since we only went live in the last month or two, I haven't seen updated statistics yet for our adoption. So unfortunately, I can't give you an answer to that one.
No worries. Okay, so switch gears again, if that's okay. So just at a high level, one of the perennial topics that we probably haven't done enough about, the social determinants of health, the Indigenous health, minority health. COVID-19 highlighted and caused, a high death rate in those populations. Just to what extent can the HIE perhaps help us understand or address such problems? And what's been your approaches to this?
So with the social determinants of health has definitely been an important thing that has been looked at, especially with COVID-19. I can say right now in North Dakota, we're looking at the different platforms and haven't made a determination yet. We've talked with our state Medicaid office on this as well as our Department of Health. Speaking from a COVID-19 perspective, looking at Indigenous health and minority health, it has been a priority. We want to seek out these populations and making sure that they're receiving all of the services that they need during this trying time. And I definitely think social determinants of health is an area where when those data elements are brought together, it can help determine, which populations, need the assistance and where the points of focus need to be, whether that be, with food, shelter, or, other items in social determinants of health, and, where the priority population where the population is seeing more need than others. And I definitely feel the HIE, can help with the data to understand and address such problems when it's applied correctly.
I think one of the challenges is just sourcing the data for these things. In the UK, we've been able to connect to various social welfare agencies, and they give us some of the data they have on some patients. The challenge, I think, is even in the UK, being sure you've got the right person, the classic HIE matching individual, the right privacy and security things. And then when you get the data, just to really figure out, okay, well, what am I going to do with this now? But definitely something that's going to continue.
Well, you highlighted a good point. It is a partnership between a lot of different organizations and agencies. So in HIEs, we built this and talked about the different partnerships which have health information and exchange. And now with social determinants of health data, we're going into more of that social services realm and those types of resources and different type of data. So, really, and similarly to HIE, it's really about those partnerships and, as you said, making those data connections.
Yeah. So that brings us to the new CMS and ONC rules, and in particular the rules around information blocking. So I think our audience will be very interested to know how you see the rules from a North Dakota and NDHIN perspective, and have you had issues with information blocking, and do you see the new rule as being helpful in that regard?
Yes, Chris. So from a North Dakota perspective, I will say over the years, we've developed good partnerships with our stakeholders and our participants across the state that are sharing information and retrieving information through the HIE. That being said, there are always gaps in certain areas that we've experienced and been working to overcome over the years. So I feel that with coming through with the ONC and CMS information blocking rules, that that'll help limit those gaps and provide a richer source of information to our participants across the state. I know we've had discussions even before the ONC information blocking rules with partners and payers across the state. And right now, some of it is shifting to in what ways can we help them meet the requirements, and really showing the value of the HIE to payers and other participants moving forward. So overall, I really do feel that CMS and ONC is really a positive thing with this information blocking rule, and especially nationwide as we move forth, because information, what I found with my studies is, as health systems work to move forward, some of the biggest things that come across is communication and collaboration. And any ways that we can find to streamline that, I feel will really improve the outcomes for those individuals, that the patients that are receiving care, and it'll maximize provider time as they're caring for these individuals. So really with the health system, going to a theoretical perspective, it really comes down to, I like Donna Beatty's structure, process, outcome. The HIE, we're creating the structure, the processes we're working with are that data sharing, to help patient care. And in the end, if you improve that structure and process, the idea is the outcome, which hopefully is patient outcome, patient care, is improved in the end. So we're really trying to, with HIEs and the different things, streamline communication so that it's easier for patients to get quality care that they deserve.
Excellent. I'll try and slip in one more related question, if that's okay, and we can keep it really brief. So the question is, again, from NDHIN perspective, do you have payers participating in your health information exchange? And do you see any role in assisting the payers around the patient access and interoperability obligations?
Yes. Currently, we do have payers involved. We do find it's more the case managers with the payers that are involved and find value in the HIE. We've been talking with other payers in our state that have not participated yet on these ways, that looking at ways where NDHIN can assist them to meet those requirements. And so we're really early. We're having those discussions now, and I'm really excited for the future. And, it's a new way to utilize the HIE, for the greater benefit. So it's exciting.
I think you and I share the excitement. It is really good to see some barriers going down and some really good progress being made. So thank you so much for your time today, Shila.
Thank you.
Thank you, everyone, for joining me today on Chief Among Friends. For more information, don't hesitate to contact me on Twitter at Dr. Chris Hobson, LinkedIn, or visit our website at www.orionhealth.com.